Einstein's definition of insanity is doing the same thing over and over again and expecting to get a different outcome. We are doing things differently. That's what Wellbeing Exeter is all about. So we all know that the NHS is overheating, that demand is rising and so are costs. We believe that Wellbeing Exeter has some of the solutions to some of the underlying reasons, and we think it might help us in the long run to reduce costs but also improve people's lives.
A local GP said to me, "I have too many people coming through my surgery looking for a medical solution to a social problem. I'm being asked to write prescriptions for tablets when I believe what they really need is something to do and some friends."
You know, essentially we're social animals and we're not designed to be on our own. And I think what often happens with patients is that they, for whatever reason, become lonely. But in their mind, these things tend to grow and grow until they become a problem where at some point they will come and seek medical help for it. And of course, the answer to it isn't to deal with it as a medical problem, it's to deal with the underlying problem, the crux of which is their loneliness. And if we can get them connected socially, then they're not only likely to be happier, but they're also less likely to come and seek help from the medical services.
We recognised really early on that this is not a problem for the NHS to solve on its own. This is about society. So what GPs need is somebody that they can trust, someone that they can refer their patient to, who can then be that bridge between the GP practice and the community, someone that can get alongside a person and help them to work out where the help and support that they need is available in their community and effectively connect people to each other and their communities.
So one of the key roles of any GP is to listen to your patients and then to be aware of the whole array of services that might be available. But if we're to help people from a social perspective, then we don't just need all those sort of traditional medical roles. We also need to be able to access sort of social organisations that might be out there. And the great thing about having a connector involved is that it's their job to keep track of who's out there. And then I can just make the referral to that person, and then they can worry about which of the organisations are out there is best for my patients.
Quite often when I meet with people, they tell me their story and they go through quite in depth what it is that they feel went wrong or where they want to go in the future. And I think having that person just listening to them and seeing what it is and hearing and taking the time seemed to be really beneficial.
My marriage broke up after 30 years and I went to see my GP because I was feeling quite isolated and asked if there were any community groups that I could get involved with, and then within a couple of days I got a phone call from Annette. So that's how it started really. I would say that Wellbeing Exeter is incredibly supportive. They open up avenues to you for things that you could do.
It just provides that support in terms of making a change in people's lives, and it's really fascinating for me to see what that support can do. So it might be support with mental health, or it might be lifestyle change in terms of physical health that they're interested in, and with a little bit of support they can actually get on and do that.
So the ability of the GP to be able to refer a patient to a trusted connector who has relationships with community builders who know what's going on in the local area. We think those two things coming together is the really different bit about our experiment.
Health and social care is in crisis in this country, and we're not going to commission our way out of this. We need communities to come together and to step up. The anthropologist Margaret Mead said, "Never underestimate the potential of a small committed group of people to change the world." In fact, it's the only thing that ever has.
The purpose of community building is really simple. It's building on the good. Every part of the city, no matter what issues and challenges people are faced with, there will be some really great relationships, there'll be some fantastic neighbours, and there'll be people doing things for each other.
Our society is changing and we seem to be becoming much more fragmented with where we live and our reasons for living there. And I believe that this role enables people to develop those relationships within their community. You know, we're humans, we love connection, and to feel that connection in the place where you live, I think is really powerful.
Whenever there's been a major crisis in this country, it's the community sector that has mobilised and has brought relief, has brought aid, or has organised communities in order to meet the challenge. We can either wait for the politicians, the civil servants to sort it out, wait for some sort of top-down solution to come, or we can mobilise as communities. The HIV crisis was solved not by global pharmaceutical companies or politicians, but by activists from the LGBT community who came together and literally changed the world.
We already know that lives are transforming, and we're hearing about great things happening in communities. And what we need is more time to prove what we know in our hearts to be true, that this will save us all money in the long run. And that can only be a good thing.
It's just about getting to know somebody and giving them a bit of emotional support. So I feel a lot more confident in myself now that I can be doing some good for other people.